Name of instrument, its classification, it's general or special. If it's in general group, you should know it's a subtype, it's instrument for tissue disconnection, connection, auxiliary or hemostatic instruments. Here in this box, all instruments for exam. That's why you should know just about half, no more. If you want to know names of instruments, largest part of these instruments and just few instruments not present on the stand. That's why if you have a photo and you have names on stand, that's why you can use it too. This one, mosquito hemostatic forceps straight. This one, instruments from future topic. We will talk 2 classes later about operations on parenchymal organs. The shape of this opening showing us shape of organ for clamping. Very often mistake, it's students think that it's testis. Yeah, but except testis, we have in the body gallbladder. That's why it's for gallbladder. You do not have this ectomy. Mechanical retractor. I showed you a few times. Mechanical retractor for opening of abdominal cavity wound and chest wound. Rib cutters or rib scissors. This one rib cutter, general rib cutter. This one for first rib. Here I will put instruments which for next semester. Ellis forceps. Ellis forceps we can use in abdominal surgery for intestine, small large intestine, for fixation of peritoneum, parietal, visceral, during colostomy, during formation of artificial anal canal, for fixation of pleura too. That's a universal instrument for fixation of thin structures. Here, crushing intestinal clamp. Crushing. Somewhere here should be elastic intestinal clamp. Abdominal retractor. Function, it's assistant hold it and making a wider operative wound during the laparotomic approach. One of the first instruments what I showed you is our bone elevator to pick up fragment of the bone during osteoplastic trepanation. Bone elevator with blunt edges. This one instrument, sterilizer forceps. It's to pick up some instruments from sterilizer box without touching of this box. Mosquito hemostatic forceps, but carved. This one, dull green, bone cutting forceps. It's for section of the skull when we need to do osteoplastic trepanation when we not have jiggly saw. Jiggly saw is better. It's a primary instrument for section of skull for osteoplastic trepanation. If it's damaged or not present, we can use dull green bone cutting forceps, but here traumatization bigger because our wider workplace. Neurosurgical spatula to press down dura mater during neurosurgical operations. Here, Kocher's hemostatic forceps carved. Two instruments for same procedure. Lengthening of retropharyngeal abscess, let's remember, mouse, dilator. This one, girls like it, tongue holder. Here, jiggly saw is fixed on the hook of Polenov's conductor. This one, metallic plate, Polenov's conductor, to pass it through openings during trepanation, osteoplastic trepanation. One more instrument for skull surgery, the Lewis forceps. It's necessary for surgical debridement or mainly for decompressive trepanation, for crushing of the bone. It's Lewis forceps. Two types of Piers clamp. Piers clamp, it's the name of surgeon Pier. pious clamp, this one intestinal, this one for stomach. Difference in this one sharp element. This is single tooth. If it's present, it's necessary for stomach, for clamping of stomach's wall, and for it passes through or less and making perforation. And of course it's more traumatic. That's why part of the intestine or of stomach which we clamp by this instrument we must cut and remove. This one is free from sharp elements. They are just hard clamping of intestinal lumen. Rivedin abdominal spatula to press down in abdominal cavity intestinal loops during suturing of a laparotomic wound, and it protects intestine from injuries by needles, because we can drop this needle just to this plate. Rivedin abdominal spatula. This one, Doyen's rib raspator or rasp. It's necessary for cleaning or for separation of perostum from backside of the rib during subperostal resection of the rib. C-shaped plate hook. Farabeuf's C-shaped plate hook. It's like any other hook for dilation of operative wound. And because we're talking about hooks, one more kind of hook. They are very easy for understanding. You need just to see what are you holding. This one hook with 4 blunt teeth. This one hook with 3 sharp teeth. There could be a different number and shape of these hooks, but function same, dilation. Heart mirror. Elastic heart mirror to pick up heart and check it backside during its injury. This one, anesthesiological hammer. Yeah, of course no. It's a surgical hammer. We studied just one procedure when we need it. Next semester we'll study one more. Which one operation need hammer? And one more instrument, groove chisel. The or antrotomy, or other name, trepanation of mastoid process. Trepanation, just trepanation, not enough. Trepanation of mastoid process. How do you think this hammer from wood? What will happen with wood during sterilization? Yeah, under the pressure, under temperature, high temperature. This is, let's see, its structure. It's carbon. Yeah, plastic carbon. Hook, single sharp hook for fixation of the larynx during which one operation? Tracheostomy. Metallic cannula for tracheostomy. Tracheal dilator. For which one operation? Tracheostomy. You know this one, if you saw. Dressing forceps. Semi-automatic and mechanical. For fixation of operative dress. Microsurgical scissors. You walked each class with this instrument. This is needle holder, but which one? Without name, yeah? Hegas needle holder. This one, Hegas needle holder, carved. Here needle holder, one more, the atraumatic needle holder, 4 traumatic needles. In difference with this one, that there are smaller workplace of the needle holder to not damage needle, atraumatic needle. Here, general surgical scissors with name Kufes. Here, they are with bluntage. There are special scissors for enterotomy. This one, olive bulb, protect back wall from section. It's enterotomy, but it doesn't mean that it's only for intestine. Stomach, we can cut it too. Here you see two types of drills, lancet shape and globular shape drills for drilling of the skull during trepanations. One more instrument from future topics, the instrument for operations on parenchymal organs, and the transverse section of organ look like a hole between branches, the tail of pancreas, for tail of pancreas. Biliary hemostatic forceps cuffed. Biliary hemostatic forceps straight. Core has hemostatic forceps straight. Gripping pincet. Different types of scalpels. First of all, you should remember how we can hold it. 3 positions for scalpels. Here, full metallic bellied scalpel. Here, full metallic lancet-shaped scalpel. And here, most modern version, most popular, the scalpel, bellied scalpel with changeable blade. Blade, you can change. And last 2 instruments here in my hands. There are 2 types of probes, olive probe and groove probe. Olive probe have a blunt edge and it's help us to, we can touch something very small to check wound canal, some fistula or something, what is very small and is much smaller than our finger. Olive probe and groove probe, this is a handle. Olive probe necessary for us. And the groove probe necessary for us. We can cut some thin structures like fascia, like peritoneum. We are making first small puncture of the necessary layer. Then we put it under this layer, this groove, and we see as are present some vessels, nerves. We can separate it, make it free, and then we are cutting along of groove. Blade looking up. Groove probe. That's all. This instrument for next semester.